today we are working with our patient named Jake, who has, according to his symptoms, we believe he has a disc herniation between cervical vertebrae 5 and 6, as well as some cervical radiculopathy. We've decided this because of some symptoms he's having down his arm. Some indications for traction therapy, which is what we want to do today, are nerve root impingement and disc herniation. Some contraindications that we need to check with him are acute inflammation, acute sprain or strains within the first 3 to 5 days, fractures, vertebral joint instability, non-mechanical pain, peripheralization of symptoms, osteoporosis or osteopenia, prior surgical stabilization or decompressions, spinal implants or prosthetic discs, or cardiovascular pulmonary diseases. Hi Jack, how are you doing today?
I'm good. How are you?
Great, awesome. So, my name's Kelsey Banner. I'm a student physical therapist working under Dr. Clausen.
Okay.
So, from all of the tests that we've done on you and your neck, we've come to a couple conclusions what we think is causing the pain, okay?
Okay.
So, we think it's actually what's called a disc herniation between some of your cervical bones back here, your vertebrae.
Oh, okay.
So, between 5 and 6. So what that means is like a lot of this motion has been causing some of that fluid to escape from between your vertebrae. So what we want to do is a treatment that can help bring it back in and make a little more space.
Oh, great. Okay.
So especially because we think that's what you have, and definitely from all that tingling going down your arm, that's definitely signs of a nerve root impingement. So both of those things are definitely indications for a treatment we call traction. Have you ever heard of traction?
No.
No? Okay, no worries. So traction it's a very old treatment. So it's been used for a very long time. So it kind of looks a little medieval when you look at it. It's just this machine right here.
Okay.
So we're just going to apply a little pressure to just kind of add a little space between the bones in your neck.
Okay. Awesome.
We'll start off very light. So it should not be painful or anything. It should just help relieve some of your symptoms.
Okay. Sounds good.
So throughout, are you okay with that we do that today?
Yeah, that sounds great.
Okay. All right. I might have your permission to get you all set up and just make sure we're feeling okay in your neck and everything.
Yeah, that'll be
Okay.
good.
Perfect. Okay. So throughout this treatment, I want you to make sure you talk to me and tell me anything you're feeling that's not comfortable. Anything that's even just a little bit uncomfortable, tell me, okay?
Okay, sounds good.
Awesome. Okay, so we're going to go ahead and set you up. All right, Jack, so before we get started, I just wanted to check there's a few contraindications, precautions, of things we need to make sure you don't have before we can do traction.
Okay.
So I just want to check, okay? So I just want to see if you have any acute injuries, so some injury you got like 3 to 5 days ago.
No.
Your neck? Nope, okay.
No.
How about any fractures?
No.
Surgery?
No.
None of that? Okay.
Mm-mm.
Do you have any cardiovascular or pulmonary diseases?
No.
Okay. Do you have any bone issues?
No.
Like osteoporosis or anything? Do you have any, any non-mechanical pain? So pain like from besides the one you just had
No.
in your neck?
No.
Okay. Just besides that injury. Awesome. All right, great. We're good to get started.
Cool. Thank you.
All right, Jack, now that we're here, so I'm going to have you lie down.
Okay.
And you're going to lie down, so this is right here in between your ear and your shoulder, okay? And we'll adjust after you lay down, okay?
Sounds good.
Yeah, right here. Is that comfortable, okay?
Yeah, that's great.
So I'm actually going to have you scoot up just a tiny bit more.
This way?
Yeah, just a tiny bit. Yep, because we just don't want to push it on your bone there, okay?
Okay.
How does that feel?
It's good.
I'm going to tighten it a little bit, okay?
Okay.
Does that feel okay?
Yeah, just a little more.
A little more, okay.
That's perfect.
Okay, we don't want it pressing too hard, okay?
Okay, I think it's good.
Okay, perfect. We got all these towels here, so nothing's germs. Put that. We want you to be able to see though.
Mm-hmm.
Does that feel okay right there?
Yeah.
Alright. Tighten each side here. You just wanted just a gentle pressure. Does that feel okay?
Yeah.
Okay. Not too much. Perfect. Alright, so before I do anything, I'm just going to tell you what you need to do if you feel any discomfort or pain, okay? Because as we go on, this first time I'll be with you, but as we go on, I might leave you in here because you'll get used to the treatment and it won't be anything new.
Okay.
But we have this button here. If you feel any pain or discomfort, I want you to click it, okay?
Okay.
Because it'll stop the treatment and it'll slowly back off.
Great, yeah.
So just make sure we always have that with you. I'm gonna leave a bell in here for you, and I'll put it right there.
Okay, perfect.
So if any discomfort or pain, you can also ring that bell, and we'll come right in. Okay.
Perfect. Yeah, that'd be great. Thank you.
But of course, today I'll be here with you. Okay.
Okay.
All right. Get that set up. Does that feel okay still?
Yeah.
Perfect. And I've got it at this level because we suspect a disc herniation. So we definitely don't want too much flexion. Does
Okay.
that feel comfortable where you're at?
Yeah, it feels good.
Because we can definitely go into a little more flexion if you feel like your neck's too far back.
No, this is great.
Okay, perfect. Alrighty. It looks like we're all ready to get started. Okay. So we're going to go to cervical. And we're going to start off with manual. And we want the anterior approach because we suspect a disc herniation. Okay, let me know. I'm going to start ramping up the number. I'm going to go real slow, okay? We're going to slowly add weight. Let me know how you're feeling.
Okay.
Feeling anything there?
Just a little.
Just a little, okay. We're only at 5. How's that feeling right there?
That feels good.
Feels good? Okay, I'm gonna go just a tiny bit more. We're not gonna start too much higher than that because it's your first time. How's that feel though? That feels good? Not too much or anything?
No, I like that.
Perfect. All right. Okay, if it's your first time, we're just gonna go like 5 minutes. See how it feels, okay? All right, I'm gonna go ahead and start it. You still feeling okay?
Mm-hmm.
All
Yeah,
right.
it feels good.
Okay. I'm gonna stay with you here about a minute, and then I might just be heading out of the room for a second, okay?
Okay.
All right. All right, it's been those 5 minutes. How are we feeling?
Good, yeah.
Great.
Yeah, that feels
Okay.
awesome.
That's awesome. All right, I'm gonna go ahead and stop it.
Okay.
All right, it's resetting. All right, we're gonna go ahead and take all these off. Okay. All right, we're still feeling okay?
Yeah.
Awesome. Glad to hear that. All right, you're actually good to sit up. I want to just inspect your neck there and make sure we don't have anything going on there that we don't want.
Okay.
All right, so if I could actually have you go ahead and sit down there.
Okay.
All right. Looks like everything's okay. You feeling all right?
Yeah.
Perfect.
Mhm.
Awesome.